Hi, my name is Elizabeth Ayyad, and this presentation is on Big Data and Analytics in Healthcare. This presentation is for Professor Stumphs' 415 class at California State University. In this presentation, we're going to go over four main ideas. One being, where does big data come from healthcare? And we're going to describe what big data and analytics is, like who controls the other one. And the third objective would be giving an example of big data in healthcare. And lastly, we're going to go over blockchain. Like, is it related to data, big data, or is blockchain a completely different idea that is not related to healthcare? But we're going to go and find out. So we need to understand where big data comes from a healthcare aspect. Well, big data comes from lab orders, doctor notes, and if the doctor needs to address any specialized departments for this patient, then that all goes under the EHR, which is electronic healthcare records for the patient. So when we look at all the data that is in the electronic health records, we need to put these together because it helps us see how our patients are doing and how they're declining. So when we look at these data, we need to see how the analytics are. And without the data, there's really not much analytics that we could base it off of. As you can see, it's the data that helps us view the analytics of a patient's progress. Let's take Glinda for example. Her doctor gave her orders to help her join a gym to help her reach her healthcare goals. As we could see, the trainer has developed a program that fits Linda's needs, and this data helps us to see various analytics if Linda is improving or declining based on her diet and how much she's hitting the gym during the week. Everything is linked up under because of technology and how technology works now. Linda could pair her lab devices, her workouts, her nutrition all in her cell phone, and all could be reached and sent out to her doctor and her care team. Technology has risen from 2014 to 2016, and more people are accessing their health records through devices. Electric health records help us retrieve data and create analytics off that data. Healthcare records consist of lab orders, medication orders, signed consent form that the patient wants to have done and doesn't want to have done, and online charting and documentation from either nurses or doctors. Just like electric healthcare records, mobile apps to track how your fitness and how many calories burned and everything is just the same way that we could retrieve data and create analytics based off of that data. Blockchain is not related to data analytics, but it is associated with cryptocurrency, which is online banking, which is a method to get around the banks, so which also means people don't have to pay fees that they would have to pay like a regular bank and everything. So blockchain has absolutely no relation to big data at all. Blockchain refers to the blocks of the chain that represents a person or entity, which consists of an electric wallet. So really, there's no fraud involved in all of this. So a blockchain is affiliated with Bitcoin, so therefore it has electric online money. I hope this presentation has helped you understand big data and analytics in healthcare and how our devices and technology has helped us realize and help patients take care more of themselves within the future and to actually meet their goals within primary care. And also the confliction of how blockchaining is not affiliated with big data and analytics. Thank you so much for tuning into my presentation, and I hope you could come back to this video. And I hope this video helps you realize how technology has come along and helped us with our healthcare issues. Thank